So now we move on to both the inlets, the laryngeal folds, and the laryngeal cavity. So before we start, let's just get our bearings with the particular diagram. So what we've done here is we've done a frontal plane. So we've cut straight through the larynx. Okay, so it's a kind of a frontal, fairly in the midline, in the frontal plane. And so let's see what structures we've got. So the blue is going to be cartilage. So this is cut away. So this is the epiglottis. Okay, so you cut in the blue, this is the elastic cartilage, moving down to the thyroid cartilage, which has kind of been cut through. You can't see as it goes around to the front. So we're looking in at the posterior. Okay, so in at the posterior wall, at the other side is the anterior. And coming down, we've got the cricoid cartilages, and then below it, we've got the first ring of the trachea. In green, sitting on the side, is the thyroid gland, and up here in purple is the hyoid bone, and the orange is the mucous membranes. So let's just put some some membranes in, which we did just a second ago. So this is going to be the first kind of membrane between the cricoid and the trachea. So that's the cricoid tracheal membrane. And then we can go up, say, to this one, which is going to be the thyroid hyoid membrane, going like this. Okay. Now just bear in mind that we do have a hiatus there, which allows those vessels and nerves to come through. Now, so that's the thyrohyoid membrane, and we've got an artery coming in, which is the superior laryngeal artery, and then the green is going to be the internal branch of the superior laryngeal nerve, which is a branch of the vagus nerve. That particular nerve is going to supply mucous membrane all the way down to kind of this point. Whereas coming up from below is the inferior laryngeal artery with the recurrent laryngeal nerve of the vagus. And that's going to supply mucous membrane all the way up to this point. But bear in mind, the recurrent laryngeal nerve will supply all the intrinsic muscles, which we'll do in a second. Whereas that internal branch does no muscles. It needs the external branch. Now, some more membranes. So we've got to put a membrane in between the cricoid and the thyroid. So there is a membrane that kind of goes like so, which we saw just a while ago. But what it also does is it sends another thickening all the way to the front of the thyroid. So here it's going to go up, but it's going to go to the front of the thyroid as it comes around. And this is going to be obviously on both sides. Okay. But sitting back here, right here, are the two pyramids, the two arytenoids. So this ligament's going to go not only to the front of the thyroid, but it's going to come all the way back to the arytenoids and attach on the vocal process of the arytenoids. And that's going to be the vocal ligament, this one here. Okay, so it's very thick and defined. Now where the arytenoids are sitting here, so you can't really see the arioepiglottic fold, but what you can have is this membrane that's coming down like so, which is the quadrangular membrane. So that's coming down like this, and then that will come out down here to give you the vestibular fold. And that's the ligament for the false cord, or it's better just to be called the vestibular cord. Okay, so that's the true cords, that's the false. Okay, that's the vestibular ligament, that's the focal ligament. Okay, so I think that's most structures filled in. And so what we'll do now is we'll start with the inlet. So the laryngeal inlet sits up here and it faces not only upwards, so this is the inlet here, not only upwards, but back. It's the widest part of the larynx, and it's going to be the widest at the front and narrow enough at the back. So the epiglottis is sitting like that, but the folds are bringing it around like so until it hits the arytenoids at the back. So it's actually fairly narrow at the back where the arytenoids are, and where the folds come around, that's going to be wider at the front. So its boundaries, the laryngeal inlet, is at the front is going to be the epiglottis. Okay, around the lateral walls is going to be the aryepiglottic folds, and then coming around the base, sitting on either side, is the arytenoids. Okay, so that's the boundaries of it. We now move on to the laryngeal folds. So the laryngeal folds have two folds to be wary of, and this is going to be the vestibular, which we went through, so the vestibular fold. So the vestibular fold is made up of the vestibular ligament, which is then engulfed or surrounded by a mucous membrane, which I've drawn in the orange, like so. So that is the vestibular fold. So it's essentially a fixed structure, and it's pink in colour, so it's got a good vascular supply. It, as I said, is made up of that vestibular ligament surrounded by a mucous membrane. And this is the kind of inferior aspect. So if you kind of do a dotted line through here, like there, all the way up to here, this region would be the supraglottis, or glottal region, that region there. Whereas if you then go down to this fold, which is the vocal fold, which in it has some intrinsic muscles, such as the vocalis, as well as others. It's mostly made up of this vocal ligament, but again surrounded by mucous membrane, which you can see like so. And that's the vocal fold. Okay, now the difference here is this one is avascular, so it's got no blood supply, and considering it's got no blood supply, it's going to present or will look white. Okay, so as I said, this is running in this plane, so it's hard to get your bearings, but it's going to go back to sit on the arytenoids, and it's going to go front into the thyroid. So it's going to be shaped kind of like this. So if you were to look down, it would look like this. So this is one fold, this is one fold, and the base of it is the arytenoids where my thumbs are. So that's essentially how that would look like this. Now the space in there is the rima glottis, or the glottis, and that's the narrowest part of the larynx. Okay. In the male, or the adult male, this length of the vocal fold is about 2.5 centimeters. It's going to be shorter in the female, and in the child, actually down here is the narrowest part, not actually here. Okay, so that's essentially the vocal fold. So that's the two folds, the vestibular fold and the vocal fold. Now we go into the cavity. So the cavities are broken into three. 1, 2, 3. So we've done 1. 2 is going to be kind of going through here and through here. And this is the glottis, or the rima glottis. And then coming from that line down to the lower margin of the cricoid, that could be called either the infraglottis or the subglottis. So these are the cavities. So the supraglottis, as we said, is from the inlet all the way down to the vestibular fold, and that's the widest section. Then go down to the glottis. This is between the vestibular fold and the vocal fold. Now there's some structures in here, so in this area here, this big gap here, that's the ventricle, okay, whereas up here is the saccule, okay. So that's the kind of only parts of that glottis cavity, or the rima glottis. And then you go down into this section here, and this is really going from the vocal folds going down to now into the trachea, and this lower part is the infraglottis, which is really going from there to there. And that's it for the inlet, the folds, and the cavity. Now we're going to finish on the muscles. So let's finish off with the muscles on the pharynx. These are going to be broken into both extrinsic and intrinsic muscles. So once again, before we start, let's have a look at these diagrams. So firstly, this one is an anterior, it's a superior view, so we're looking down from the top down on the larynx. So this is the anterior, this is the posterior. This is going to be the thyroid. Sitting at the back are the arytenoids, and just behind you can see the cricoid. Moving now to this diagram, this is looking at a posterior view. So here we can see the epiglottis. In front of that, or anterior, is the hyoid bone, and then the thyroid coming down with the inferior cornea, which will attach with the cricoid. And then here we've got a side view. Here's going to be the posterior parts of the superior cornea, inferior cornea, which is articulating with the cricoid, and then the front. So this is the anterior, this is the posterior. And then finally we've got just a simplified view of the vocal cord in black. Okay, thyroid here, arytenoid at the back. So this is going to have a look at when the muscles are working, how they actually affect the actual vocal cord. So let me quickly put the muscles in, just so we've got the names, and then I'll go through them individually. So for this one looking down, we've got this mainstream muscle which will actually run with the vocal cord, like so, and we call this the vocalis muscle. Just across to the side, we've got the lateral cricoarytenoid, okay, and then at the back, we've kind of got these cross fibers going here. So you can see this one going like this. This is the oblique arytenoid muscle group, and then the one behind it, which is running in this plane, they're the transverse arytenoid group. So that's the muscles in this section. Moving across here, again we've got the oblique, so the oblique fibers, but they're running up into the aryepiglottic fold, so that's the kind of the continuation, but that's the oblique there, and then behind it we've got the transverse. Sitting at the back, so we can't see it in this view, but sitting at the back is the posterior cricoarytenoid. Okay, that's it there. And then coming around to the front, so the front view here, but looking at the side, what we've got here is the cricothyroid, which is the only muscle that we're going to do intrinsically that's actually innervated by the external branch of the superior laryngeal nerve. All the rest of these ones are innervated by the recurrent laryngeal or the vagus. So the muscles of the larynx, they're broken into two parts. We've got an extrinsic and an intrinsic group. The extrinsic is essentially just about moving the larynx as a whole collective group. Okay, so we've got a group of muscles. This is usually around swallowing. So you've got a group of muscles that will bring the larynx up, and you've got a group of muscles that will bring the larynx down. And so these are the extrinsics. The ones that are going to bring the larynx up will really act on the hyoid above it. So these are going to be suprahyoid muscles. Okay, so any muscle that's kind of coming in and attaching will bring it up, because if you move the hyoid bone, because of the thyrohyoid membrane, the larynx will go with it. So anything like the stylohyoid muscle, mylohyoid, geniohyoid, the digastrix, these muscles will bring it up. Whereas the ones that will come below and pull it down, they're going to depress the larynx. So any muscle that's attaching here and going down, such as the sterniohyoid, which is a strap, or the sterniothyroid, or omohyoid, so that's going to the scapula, is also going to do that. So they're the main extrinsic muscles. So now we move into the intrinsic muscles of the larynx. So these are the more smaller ones, and these are found generally more inside. They're broken into 7. So there's 7 intrinsic muscles that we need to know. The first 2 is more about moving the laryngeal inlet. Okay, so remember here we've got the epiglottis, and sitting as we go down to go into the trachea, so going into that area, we've got the laryngeal inlet. A muscle that helps to narrow that is going to be this one. So this oblique fibers of the arytenoids muscle group is going to narrow the inlet, bring it in. Whereas the one that widens it, it's going to be the thyroepiglottis. Okay, so now moving to the 5, these are the intrinsic, but they're the 5 that are going to move the vocal cord, which is this one here. So the vocal cord, just to reiterate, attaches to the vocal process of the arytenoid, and will attach to the thyroid cartilage anteriorly. And so essentially these 5 muscles will do the 5 actions of the vocal cord. So what we can do with the vocal cords, if this is it here, you can tense it. So by bringing the thyroid forward on the cricoid and therefore the arytenoids, it will tense that. And this is going to be done by this muscle here, which is the cricothyroid. So that's a tensing muscle. Okay. The one that kind of relaxes it a bit is going to be the vocalis. Okay. Then we're going to go to abduction. So that is moving it apart like that. And then we have one to bring it together, which is adduction. And then we have just sliding these 2 areas together. So bringing the bases together. And that's just sliding or apposition. Okay, so that's the 5 movements. We've got tensing, we've got relaxing, we've got abduction, we've got adduction, and we've got bringing together. And that's the 5 movements, and that's the 5 muscles which we're going to do now. So when you look at the movements of the vocal cords, it's all about moving these 2 cartilages, which is the arytenoids. So just remember that whenever you want to do anything to the cord, essentially you've got to move these arytenoids in some shape. Okay, so again, I've kind of went through it a little bit, but let's do it again. So firstly, let's tense it. So movement 1, tense. And this is done by the cricothyroid. And what that will do is essentially move the thyroid forward on the cricoid. So it's going to move it at this joint here, which is going to essentially bring that back, which will tense the vocal cords. So that's done by the cricothyroid. And this is innervated by the external branch of the superior laryngeal, which is the branch of the vagus. Number 2 is relaxing the cord. And the relaxing is done by the vocalis muscle, like so. This is innervated by the recurrent laryngeal nerve of the vagus. Number 3 is abduction, which you can see here. Abduction. And the way that this works, if you can look at this is one arytenoid, this is the other. Okay, and my fingers here is pointing towards the vocal folds like that. So this is going to be moving apart, so that's abduction, and that's adduction, and that's how it rotates. The arytenoids will rotate on the cricoid like so. So to do an abduction, you need to pull these in that direction. So we're going to pull in that direction like so, and that will elicit that movement, which is abduction, and that's done by this muscle here, which is the posterior cricoarytenoid muscle, innervated by the recurrent laryngeal. Number 4 is adduction, and that's going to be the opposite way, so that's bringing it back. So you need to somehow pull it in that direction. So you need to pull it back like that to bring it back to that. And that's done by this muscle here, which is going to be called the lateral cricoarytenoid. Okay? And that's also innervated by the recurrent laryngeal, so that's going to bring it back and tense it like this. Not tense it, just adduct it, should I say. And then number 5 is apposition, so which is to slide it back. So what you want to do is have muscles here, which are going to contract and slide the whole arytenoid back. Not rotate, just slide. Okay, so that's apposition, and that's done by the transverse arytenoids, which are these ones here behind. We saw the oblique, which is going to be the inlet, but these transverse here or here is going to bring it together. And so that's essentially how you will move the vocal cords. So why you want to do it? Well, if you're breathing, so if you want to breathe in, allow air to go in, you're going to want to open it like so, okay? And then you're essentially going to abduct, so you're going to do that. And then once you hold that, so that kind of sphincter hold to keep the air in your lungs, back to adduction, and then breathing out back to an abduction. Now, if you want to, what you'll see is you're forming like a triangle shape with the abduction. But if you were to maximally inhale, what it will do is actually cause it to go more diamond shaped. So if you maximally inhale, such as if you're exercising or so forth, it's going to abduct so much, it's going to cause it, so pulling it that way so much, it's going to cause this vocal inlet to be almost a diamond shape. Okay. In terms of the sphincter, it's about swallowing. So if you want to swallow and take food down into the esophagus, the movements there is more to do with the inlet. So you kind of narrow the inlet and the larynx will go up. This epiglottis sits right on the base of the tongue. The inlet gets narrowed by the oblique arytenoids, and then the epiglottis comes down over it to force the food down the esophagus and not through that inlet. Okay. Whereas if you want to cough or sneeze, the movement there is going to be more in the vocal cords, and that's to bring intrathoracic pressure. So you bring your diaphragm up, contract your abdominal muscles, force it up, close the glottis off by adduction, and then you open it, and then you can cough or sneeze or something similar to that. And then finally, to produce sound, so phonation, it's really about the movement of air on the adducted cords. So these cords won't be completely closed, they'll be probably semi-positioned, and so by then changing the length of that, the length and the tense of that cord will change the pitch and the frequency of the sound, and that's produced in the phonation. So that's the frequency and pitch done by the vocal cords, but actually the quality of the voice is done in the resonance system or the articulation system, which will be done in another lecture, and that's more about the pharynx, the tongue, the lips, the mouth, the nose, the sinuses. That will more to do with the resonance. But in terms of the generation of the frequency and the pitch, that's done by the air movement against these cords. Okay, so that's the muscles. Hopefully that makes sense in terms to see how they actually move. And so that's the two lectures that we've done on the larynx that we looked at, the cartilage framework, the ligaments, the membranes, then moving into the cavity, the folds, the inlet, and then just now we've done the muscles of the larynx. So hopefully that was helpful for more insight into the larynx and the function of phonation.